All right, good morning, everybody. It's nice to see you all, and I'm excited to be able to kick off our Aging in Place Work Group subgroup, promoting access to services and combating isolation. So I think if we could start just by introducing ourselves to one another, we'll kick it off there, and then we can review the agenda and see if there's anything we want to add during our initial meeting today. So I'm Melissa Smith. I'm the director of the Division of Services for Aging and Adults with Physical Disabilities with the state. I'm co-chairing with Representative Ruth Briggs King, who'll be joining us shortly. I'll use my screen just to kind of go around and prompt you to introduce yourself. If you could kick it off, Mr. Delacave.
Sure. Matt Delacave. I am a division director of adult nursing at Biota Home Healthcare, as well as the vice president for the Delaware Association for Home and Community Care.
Terrific, thank you. And Ms. Smith.
Hi, I'm Deborah Smith. I'm with Little Sisters of the Poor. I'm the assistant administrator. I'm also on the board of Delaware Healthcare Facilities Association.
Great, thank you. And Ms. Getman.
Good morning. I'm Sue Getman. I'm the executive director at the Mid-County Senior Center, which is located halfway between Wilmington and Newark.
Great. And Ms. Webb.
Hi, everybody. I'm Maggie Webb. I'm the vice president of programs at Easter Seals. I oversee our adult day health programs, as well as our home and community-based services under self-direction, which would be agency with choice and personal attendance services.
Great, thank you. And Ms. Biota?
Hi, I'm not quite sure what my role is here. I was asked to participate by the chairman of our civic association, who has been talking to Spiros. So I'm not quite sure what I'm doing, but I look forward to helping.
We're happy to have you here.
Thank
and then
you.
we have, absolutely. And then we have someone on the phone. Is that representative?
That is Ruth Briggs King. Finally, you know, technology is great when it works, but I have two different systems at home here this morning, and neither one is allowing me to access my usual state logon. So I apologize to everyone for not seeing. I actually am fully clothed and dressed and made up this morning. But thank you all for taking time out of your busy schedules to help us talk about the issue about making sure we have access to services and combating isolation. So a very important subgroup. I guess if you've looked at our agenda, we sort of wanted to talk a little bit about setting some of our own expectations and timelines. And as you know, we're on a very short timeline. The next meeting for us to give a report is on the 22nd. And so I thought that maybe one of the things that we want to do is just briefly throw out some things that we think are concerns from what we have seen, or in the case of Carol, or Civic Association representative, maybe what they experience as a need in their community. So I want to start with, I just came back last evening from a national conference with other legislators, and one of our key presentations was about aging, and we heard a lot from Alzheimer's and from some other groups. And immediately after that, I went online and I looked at, if I were living in Delaware and I went to crossing lines or something to get senior services, what I would do in the state of Delaware. And I have to tell you, I Googled aging in place. It said, find your elder care location here. And I entered my zip code, and there was absolutely nothing showing in Sussex County. There were a few things, state agencies that were listed in Newcastle, and nothing else. And so I immediately thought, if I were that senior person and I were looking online for how I would get help, I wouldn't find very much that fit me or that answered my questions. And so I think that's a good thing. And Melissa, for maybe you to go back on the state level and look at. But that was very concerning, that if I were making that outreach, because we have so many new people, particularly in Sussex County, that are coming here, you know, as boomers or in retirement. And if that's my source for information, when I Google, the first thing that pops up and where it leads me, that's not going to help very much address my issues of isolation or accessing services. And so that's just my lead in, and I'll look to hear from some of you, and then maybe we can set, we focus on where we think some of our priorities should be. But I think one of them is definitely communications for access. I can't see anything. So Melissa, you're going to have to see if somebody's wanting to talk, because I'm sort of in a dead zone.
Yeah, I'm sorry. So I'll help kind of narrate between, but yeah, no hands
Thank you.
raised yet. So I think that was a great intro. And one thing I noticed, I participated in the Chris Fraser's subgroup earlier this week, and we identified cross-cutting issues. Some of the things that were coming up were, dipping into the workforce work group, and we also already heard about outreach, information, making sure the Delawareans are able to access information really quickly. So I already wrote that issue you brought up down as a common theme that we may see as a cross-cutting issue across these subgroups. So with any other additional thoughts, anything you want to say about outreach and communication, or did you all have different additional ideas you wanted to kind of bring as initial thoughts to the work group?
Melissa, I was going to jump in and just the accessing services piece. To me, Disabbit has amazing services. You all do a great job at making sure that there's a lot of different things available to a lot of different individuals out in the community. So I don't necessarily think it's the limitation of services as much as getting it out, and visible to the seniors. So to just, echo the idea of how do we get that out to the seniors, I think is probably the bigger critical issue, whether it's via internet, and when we're thinking about our older population, do they have access? And when we're thinking about especially Sussex County, what does that internet connection look like? I know that that's been a conversation on a couple of committees. Do they have the internet availability, Wi-Fi access? And then what are some alternate ways that we can make sure that some of those pieces of information, critical pieces of information, can get to those different groups?
I think another thing for us to consider too is much like, and I'm glad we've got an Easter Seals rep on the phone for this conversation, is that isolation often is a paired thing. So if you have a primary caregiver or someone else that is really homebound because they're taking care of someone, I think they can go through degrees of isolation and other need where they're trying to cope on their own. And in many cases, once again, they don't know what services they may be eligible for, they may be able to have. And so I think that, going forward, we need to pay as much attention to that caregiver, because they might be dealing with issues on their own. And I just think how many times I've helped with Meals on Wheels delivery or something, and seen the spouse that's really homebound because they're taking care and stressed in taking care. And so when we talk about isolation, I think maybe we need to talk about different levels that may be impacted, and what that means, whether it's respite care or somebody coming into the house to provide relief so they can get out. And once again, I think it comes back to knowing where these services are and how to link to them. I just think we have so many people in my area particularly, and I think I'm the only one representing Sussex here, who have had people come in from out of state that don't know our agencies, don't know how they work. They don't know what CHEER is. You know what I mean? They hear CHEER and they think it's Senior Services, which is our primary resource, but or they think they're not eligible because in my area, maybe my income's too high. And so they automatically exclude themselves. And I'll be quiet and listen to you experts, but I think that combating isolation goes deeper into the home than we think.
Go ahead, Sue.
I fully support the need to support caregivers. I think that's a huge need. But two of the concerns I have, first is a general cultural concern, and that's that we live in an ageist society where old or older are dirty words, and people don't want to think about it until they are into older age. So I think general communication, and again, this is cultural, it's not just Delaware, it's not just any particular county, but that we need to look at aging as part of life and not as a negative illness, something that's going to, cause problems, that aging can be a good thing too. And then that points me to the continuum of services for older adults, which in my mind, because I have 25 years in the senior center business, is looking at resources such as senior centers and community organizations where people can age well, and in some cases avoid or prevent the isolation that we're talking about. We noticed through COVID that we were able to keep connection with our members, as I know my colleagues at Cheer and Newark Senior Center and Modern Maturity Center, we worked very hard to keep that connection going so that when we were able to open again, people felt comfortable returning. And so using that as a resource, as a starting place, and seeing senior centers as a site, kind of a community hub for then getting people to other services that they need. So that's what my focus has been and will continue to be.
I love it and couldn't agree more, especially about the really trying to shift the conversation to vibrant and healthy aging as a positive aspect of life, as opposed to all of the negative connotations. And Mr. Delacave, you have your hand up.
Yeah, so I want to just piggyback off of everything that's been said thus far. And to Maggie's point too, like we have such great services in the state, and it's really that educational piece and outreach, and that's a challenge, definitely in some areas, particularly, downstate where it might be a little more rural and, access to individuals might be a little more difficult. But where my head is going is, I know we have publications and, deliverables for people, but, a one pager that could just summarize numbers, where to go, resources available within the state, the very, simple high level as a starting point for people, and how we're going to get those out to people. Like Sue was just mentioning, community centers, mailings, have an electronic version, and then also to maybe utilize the resources within the state where we have data on the population, kind of like a heat map, and we know where the aging people are. Can we focus and get those publications pushed out, strategically? And then I'm going even, probably this is too far in advance, but, who's going to be responsible to do that, right? So like, is there almost like a patient navigator? I couldn't think of a term, but, where they're going to almost be marketing and be boots on the ground for the different communities to also help as well, because not everyone has, the internet or is using the internet. A lot of people throw out mail too. I know that. And then also to utilize technology. It's the age of Zoom. I like meeting in person, but Zoom also has some advantages where you can get 8, 10, 15, 20 people to be in one place without, traveling, and maybe have some educational, events for those communities. So that's all, just some ideas there.
And Melissa, if I could just jump in, because Matt, you started my creative juices started going as you were talking. I think, and correct me if I'm wrong, Melissa, but with the ADRC, the whole point is to be that sort of funnel for the older adults in Delaware so that we can sort of capture that information. What are their needs? What services could we connect them to? And the state acting, as that, I guess, patient navigator, as Matt was talking about, is that an accurate description of that role? And
it is, and I'm smiling because this is tying so nicely into either works in progress or things we wanted to do. And I'm just so thrilled to get your ideas, at least from the state agency perspective, working from home more often than before. I've seen the multitude of ads coming out of Pennsylvania for their aging services. And it's made me think repeatedly, we should do that too, and put them locally, et cetera. And so I'm very interested in to hear what, how we could better advertise and make, put different communication paths out there. And then, for the ADRC, we have several different pieces in the works to serve more broadly for a portal to other services. Right now, it's a really good portal to get to our services, but we want to strengthen application and kind of initial review of other benefit packages and other services that are either with the state or beyond the state in the community, and really serve as those connections. So we're in progress, but this is great that we'll be informed by this work group. So
one of the other things that I liked that Matt, you were talking about was that sort of one pager. And I remember, so I worked in the state of New Jersey, that's as my past life. And we used to have little magnets for seniors that they could keep on their fridge, and it had all of those like hotline information. And it was great because as somebody who would go into the home, we would look for things like that to, is there, especially if they were using the emergency response system, are those numbers there? Is it, are those connections for LIHEAP if they needed those kinds of services to help in the wintertime, as we know is often challenging for our seniors. So I love that idea, and having those critical, community connectors, and here's a number you can call, and having that accessible to them. The piece of paper, I think, sometimes gets lost in the shuffle, or, but something like a magnet or something that they can put somewhere and have it visible to them, I think that's a fabulous idea. I love it. I think it's good.
I know that as a legislator, whenever someone new moves into my district, I send them a card that has some of that specific kind of information on there. And I was sitting here thinking how a way to do that when we get notified when there's new residents, but to also do it for maybe some, because if we look at our database with DelDOT, and most people, even if they're not driving, even if they just want an identification card, that they need, that's an official source. And so if there were a way to link with them for, someone when they reach a certain age to receive this information on a timely and regular basis from us, or to just reach out and have, for many of us that are already doing this, because I include about senior exploitation to report certain things. So it's a litany of things that I have on there. And so I think that, you have to have more than one approach and more than one attempt to provide the information, so it almost, the more they see it, the more they recall it. I'm that way anyway. And so the different approaches, whether it be something inexpensive through our money mailer system that so many of our seniors love to open and see what's in that, thinking, and once again, listening to our seniors, how's the best way to reach them with a message.
I also think, we need to start sending this information out to people, or however we get it to people at a younger age. The term senior connotes somebody, who's mid 60s or older, but really people can start accessing some of the services when they're 50, and caregivers of family members may need it when they're in their 40s. So not waiting until somebody themselves is at an older age. We have other mechanisms. I know people, when they go on Medicare, there's mailings or before they go on Medicare, there's mailings that go out. The other thing is, if we use networks such as, or an organization such as the United Way and their 211 system, and other groups, to make sure that there's adequate training for people, so that when they are making referrals for services, that they have a little understanding of what's going on. I know that everyone tries, but I think that's also where some of the frustration comes in, is if you get somebody on the phone who doesn't really know where to direct you, and then you end up going around in circles.
Yeah. And you're perfectly right. I think organizations like our veterans organizations, where people tend to engage and it's social and it leads, at any age level, but we look at some of where people are gathering as a natural way to help start getting that message out. As you said much earlier, looking at some of those other things that we can do as well.
I was going to share to piggyback off of that message. So, and if you all share this information, I'll know where it came from, but my husband turns 50 next year and we're already getting AARP stuff. So I 100% agree, Sue, getting that information. And again, I'll know if you all share that information. I'm just kidding. But Sue, I think that's a great idea, right? Having that message up front a little bit sooner so that there's some talk, there's conversation, there's preparation. For those of you, I don't know, I know Melissa was on, I know Representative was on last, our meeting about a week ago, and there was some really compelling stories shared by caregivers out in the community of what they were going through and how, some of their circumstances had changed. And when we're talking about promoting access to service in isolation, interestingly enough, these caregivers were taking care of a spouse and those spouses passed away. And then, I think Melissa had asked some of the pointed questions of, did you utilize any services after that or even during? And a lot of the times the answer was no. And then here they are now by themselves in their home, sort of trying to navigate, what do I do next? And now I don't even have that loved one with me, and where do I go from here? So again, kind of circling, not really providing an answer, but sort of circling back to the initial conversation about making sure that not only getting that information out earlier, but, really connecting with those caregivers, because ultimately, while they may not be the individual directly affected now, they will be probably sooner than we think. And we want to make sure that they're prepared for, for any steps.
Should we look? Oh, I'm sorry, I can't see any hands or anything. I was just going to say, should we look what we're doing at the opposite end, and that's for prenatal and newborns, and how we're having physicians and providers being that vital link about asking certain questions and providing information on access to resources. I'm not sure. I know in our area, we have a very limited, and a challenge with primary care physicians, but just wondering, and I know they start asking certain questions at certain ages, but maybe they could be handing out some of that information. Granted, they don't have the time to navigate, but they could at least give them, when you start reaching a certain age, if they would be our partners, some of these providers, and helping get that information out. Just a thought.
Great, thank you. And Deborah Smith, you had your hand raised.
Yeah, I did. And I'd like to add to the fact that you were talking about the younger age people, 40, 45, 50, that are entering the caregiver group. I was one, and I've taken care of grandparents and parents of my husband's and of mine. My mother's currently a resident here at Little Sisters of the Poor. So that was very difficult for me to find resources. I started out, I was going to school at the time, and I learned some things in school, but I had to look around locally what was available. I ended up having my mother-in-law go to a senior day care program that was attached to Newark Senior Center. Newark Senior Center offered activities for the other set that were more active, and they could go on trips to Atlantic City and be with other people and not have to worry about driving that distance. So the senior centers, and then also I learned a lot through going to elderly. They had nursing homes there, aging services. vendor fairs, I guess you want to call it. They have a big one. They used to, when I was taking care of them, up in Hockessin at the PAL Center every year. And there's a host of services up there that you can find out about. So that's how I learned about what was out in the community as a caregiver. I think it's very important to get that information out through the senior centers, through these vendor fairs, libraries. Those are some of the things that I used as a caregiver.
Thank you for bringing that up, because what I was so struck by last week in listening to testimonials is that universally the caregivers were giving each other the resources and the information and really reaching out to one another. And you know, on the one hand, being representative of the state, I was saying, well, that's terrible that they don't have easy access to our information. But on the other hand, there's something there to leverage from the pay it forward kind of, I think, culture among caregivers. And so how can we definitely increase our visibility so that the resources we can offer caregivers are available? But are there ways and platforms to bring caregivers together more often and to give them that opportunity to network, to share information, and to really leverage that community feeling of you know, sharing the experience of caregiving? And I think you brought up a couple of great examples. And so I don't know, that's been in my head since, of how can we really bring them together to share and you know, far beyond support groups, but really a network, so that there's somewhere to go and somewhere to access that kind of peer support.
In my case, I had the advantage of going to school at the same time. I went back to college, and then I started becoming a caregiver. But so that helped me a lot. But initially, if I was not in college, I would not have known, like, where do I start? Where, you know, I had no clue where to start.
You know,
That-
I was going to say, interesting. So Easter Seals does a caregiver conference every year, and it's a great way for everybody, you know, who is a caregiver or looking for those resources to come together. And interestingly enough, this last year, where I know everybody's, you know, getting a little bit zoomed out, but last year we held our conference virtually, and it was probably the most attended conference that we've had in a long time. So I think to what Melissa was saying, and echoing what you were saying too, Deborah, that you know, people are looking for that network, they're looking for that connection. And especially with COVID and everybody sort of, you know, those caregivers being a little bit more isolated in that home, looking just for that network of support to say, okay, how do I do this? How do I navigate down these roads? But
right.
I think it was a definite testament to that need that you're speaking of, Melissa, of getting that group together, not just to share, but to also provide resources and next steps and,
Right.
you know, what we can do to help support them.
Mhm.
Listening to everyone, I think I've sort of come to, you know, when we're talking about words that, you know, have a different connotation, like old or aging or different things, I think that what we're pushing up against is that strong urge to be independent, to not be labeled, and to a certain extent to overcome denial, because many times, you know, you're denying even seeing those changes in your spouse or seeing those changes in yourself. And I will speak because I'm probably one of the older ones in this group, whether you all realize that or not. But I lived through being a caregiver for my mother with 9 years as she advanced through dementia and Alzheimer's. And so having watched those different stages and noticed the different things that we go through, that we don't want others to know, maybe that we're not functioning at the same level we were. There's that level of denial or afraid of that stigma or whatever. And I think those are some big things educationally that we're going to have to overcome to get people to connect and realize that it's okay to avail yourself of these services, that just because you're asking for help as a caregiver doesn't mean, you know, that you're necessarily overwhelmed or that you're not capable, you know, because there's just like that, well, I can, you know, I think we're, you know, until we learn to overcome this generational concern, that's something on a higher level that I think will affect all of what we're trying to do across the spectrum here for for aging in place.
So here's kind of a different, not different, but an add-on thought about teasing out the isolation piece. And I love the nuance that it's not just isolation of the older person served in the community, but it's also isolation of the caregiver, experiencing that role. And COVID has given us this unique opportunity to look at our lessons learned in both where our strengths and our weaknesses are in Delaware in combating isolation. And so if now's an appropriate time, I wanted to put that out there and see if we could kind of catalog what worked, what didn't work, where are we kind of on the right track, maybe from improving our broadband access statewide, which is, I think one big effort going forward to, acknowledging that technology isn't always going to be the way to combat isolation. So I'll stop there and see if there's some thoughts there from what we've learned and how we might leverage that to more sustainable efforts going forward.
I'll jump in. For our community-based services, they kept going as really without any hiccups or hesitations, which was a beautiful thing. And I think what we learned on our end is that if the individual has that family unit during COVID, that family unit really came together. They were really there to help support, sort of figuring out and navigating what that looked like. The challenge for us is if the family unit was minimal, maybe one other person, there was some struggles just in terms of what they needed to do, how they had to, navigate through, the times of uncertainty. Unfortunately, we, some of those, when we could grab them and walk with them, it definitely made it easier, but we didn't find out some of that until after the fact, right? All of a sudden you hear a year later, yeah, well, we were having challenges and we were having difficulty, and we're thinking like, oh my gosh, if we had known, we would have done, X, Y, and Z to help support you. But I will say that if there was a family unit in place, a pretty supportive family unit, then it just got stronger during that time. That's what we saw.
I think as a caregiver, the most important thing to me was some respite time, because I was a single person that took care of these elderly folks, and reason for adult daycare, and reason for going through the senior center for activities for the older folks that could do the activities instead of being at home and not having to drive far because their driving skills had diminished. So it was all dependent upon me to do this, and it's impossible. You do need help, and so I went looking for it and found some help, and some respite. I think that's very important for a caregiver.
What we learned through the pandemic, and I think still are, because we're not out of it completely. First, finding diverse ways of connecting with people. So for some of our members, we called them on the phone. Some people, we sent things through the mail, the newsletter, but also other materials that we sent to them. We made it possible we didn't, but through City Fair and others, we were able to do grab and go meals so that people could drive here and get the food while we were closed. And we still have some people who don't want to eat here and don't qualify for home delivered meals who are coming to pick up their food. Some people could participate in virtual activities, classes, support groups, things like that. So being prepared to offer services in diverse ways was something that we learned. And we also found that we could open safely and securely. And there are ways, and we still have COVID protocols in place, although they certainly have relaxed from when we reopened last August. But it is possible to gather now and to do things together so that people aren't completely isolated at home. And making provisions for that, I think is really important. But it is a big step to get from shutting down completely, whether it's yourself or an organization, to opening on a gradual basis. But I think getting back in person as quickly and safely as possible is important.
Mhm.
Melissa, before you jump, I actually had a question for Deborah. As a caregiver and as somebody who is looking for services at a really critical time, and you spoke about respite and needing that respite to be able to take a break. Can you talk a little bit about that process just for us, for our understanding? Because, you know, we know that there's respite services available. Was it difficult to access? Was it difficult to find? And then was it difficult to also then find the support to have somebody come into the home? I'm trying to get a picture when we're talking about, you know.
When I started, I was in college full-time, 100% online. Started caring for my elderly relatives. I don't know how I came across it, but University of Delaware has a program called Lori's Hands. And they use their college students to volunteer, come and sit and talk to them, offer small services, such they would go to the grocery store and pick up a list of food, things that I would not have to do. You see, this is where the small respite comes in. Not necessarily do I need time off, but I need help. And so that was the first organization. And in fact, my mother still keeps contact with a couple of the girls that came. And then I used, like I said, the daycare for my mother-in-law. She needed some extra help that way. So she wasn't stuck at home because she could no longer go. My parents couldn't take her when they could drive. And so, yeah, so I found something for her to do that way through the senior center. And then I went to these aging resources. Later on, my father had passed away, and I found that my mother qualified for the PACE program, which I had no clue about. And so she was a participant there. And then after she left that program, she came here. But so yeah, so it went from very small respite to large respite.
Thank you for sharing that.
You're welcome.
Just a follow-up question for you, because it was a challenge that I faced, and that was having consistency. You know, a lot of folks went either for my well-being or for the others. I didn't want to have my home be a revolving door. And my mother certainly wasn't very accommodating to unfamiliar people coming in. As she had referred to at one time, we were having some different services, whether it be PT or something else, about a different person every day, and that continuity of care. But it was that consistency and comfort level. And I think that's so important to families to know, if I'm going to be, you know, leaving my loved one in care so I can go out, I don't want to worry the whole time I'm gone necessarily about that person. And the comfort level decreases every time if it's a new face that I don't know, or that aren't familiar with her, or don't understand. I mean, do you think, was that a concern for you in getting some respite care?
Well, like you were talking, the PACE program seemed like it would work for my mother. I was not at all happy with a lot of so she didn't stay with the program because, like you said, there are many people coming in and out of the home. There were a couple issues that came up with it, but you don't know until you try. You know, maybe with time they may be able to work out their kinks, but I think it could overall be a good program. Needs a little work.
And thank you. That's why I asked, because if we're not having this kind of authentic discussion and saying, here's some of the things that we face. You know, some agencies do things better than others. Some people rely on private sources to find this person, and you know, there's a degree of vulnerability when you do that. And so I just, you know, think about, is there a way to, you know, to know that trying. I knew the more consistent, when I got down to I had 1 or 2 people that were the same people over and over, it made a significant difference in feeling my comfort level, but feeling hers too, that she felt like she was building a relationship. So, and I think that relationship is important.
She did develop relationships with some of the caretakers. However, she only needed medical care at home for those times that she was in the hospital. So they, you know, that she had a regular staff of medical people. Where different people would come in is in the housekeeping area when she needed to have housekeeping done, light housekeeping. So she'd always have somebody different. And yeah, so like I said, it could be a very good program, but it's relatively new, and a little bit of work on it would probably make it a great program, you know, for those that are needing that. I mean, they offer everything from medical care to they have a like a senior center there that they are able to have get out of the house. They provide the transportation to and from. They do light housekeeping, so it really covers all the bases of someone that is home in the community that is not able to afford other services.
I want to pick up on one thing I noticed, which is another cross-cutting issue with the workforce work group, and that's just the continuity of care. And obviously in the current environment we're in with such a dire shortage of our home health aides, that's a big issue. And I know certainly we're seeing it with the care that we, you know, authorize and deliver by way of our providers. You know, we have frequently requests to keep the same aide, not have it move around, and it's just not possible with the workforce right now. And so I'm flagging that for a cross-cutting issue. And I wish them well on figuring the workforce issue out. But just in terms of combating isolation and access to services, I'm hearing loud and clear that continuity is such an important thing. And particularly, I would say more so with our older Delawareans that are suffering from dementia, you know, doubly important for continuity of care. And so, I don't know, I just wanted to point that out, and I'll flag it for a cross-cutting issue, but perhaps if there's ways we could think about helping to support that, we can do so.
I think another maybe cross-cutting issue is the affordability of services. And Deborah said her mom qualified for the PACE program. Not everybody would, because their income might be $1 over
Right.
ability level. So I think that also is something that whether it's isolation or access to services for caregivers or people wanting to stay in their own homes, age in place, the ability to pay for those services may be a challenge.
I think the PACE program is an excellent model, but it requires a huge workforce.
And Sue, to your point, I think the affordability also gets to the diverse approach, and that we're going to need that. Fortunately, aging is common to all walks of humanity. And so we need to diversify the way we reach out to these individuals to make sure we're reaching them where they are.
Mm-hmm.
So as we approach our halfway mark, I want to see Representative, if you have a path forward you wanted to suggest, just in terms of how we wanted to organize ourselves for next steps. I wanted to make sure that we're paying attention to the agenda and that we need to look at our timelines and let's see here, timeline and deliverable expectations. So is now a good time to maybe kind of take the temperature of how we would like to get organized and proceed?
Yeah, I think that's good because we've talked about, and I think we've really honed in. I've been making some notes of how I would categorize our discussion. So I think that's what we need to do is to sort of hone in on this discussion. So when the group meets on 11/22, we can sort of, because I think we're going to find, I haven't listened to some of the other groups, some overlap here. That's what I'm anticipating anyway. It's usually worked that way with some other subgroups, that what we're identifying or covered will be ideas that are brought up by others as well. So I do think we need to sort of, summarize, if you will, and maybe get some additional research if we want to explore something that may be done in another area for some recommendations, that we could do. So.
Okay, I think maybe timelines would be driven by activities. So maybe we'll go with what we want to do with this conversation first, and then we can maybe start to plug in timelines, if that makes sense. And so Will, I was very, remiss in not mentioning and thanking Will and his support to the entire Aging in Place work group, including the subgroups, because he's just been the backbone of getting us moving and keeping us running. And I know he's taking notes in the background. Is there something we should or could look at that might help anchor us, Will, or should we just keep with our narrative, which I think is getting us where we need to go?
Well, if you would like, I can pull up the objectives that the full body agreed upon, just to kind of give an idea. Again, they're fairly broad, but they may be able to form something of a skeleton so you can build specific activities. So I'll share that right now. And also thank you. I'm happy to do this.
Excellent. Well, thank you so much.
That's what I'm sorry, since I had it on, but I can't access anything I have online right now. So
It can feel so disabling to lose that technology.
Yeah.
I feel for you.
I feel discombobulated because you have, and that just teaches you when you keep your notes and everything online and you make your comments that way, and then when you don't have access. And I was traveling this week and returned late last night and was surprised this morning. I expected everything to work like magic.
Okay, so he's got the document up on the screen with some great bullet points already identified for us. I'll read them out loud, Representative, just so you can hear them. So for promoting access to support services and combating isolation, the first bullet is review existing resources, for example, websites, for finding and identifying service providers in Delaware. And a sub bullet of that is to determine if there's room for enhancing public awareness of and access to home and community-based services. I do want to point out here a cross-cutting issue, but not just within this work group, but hearkening back to a couple of Senator Poor's subgroups, both with the looking at DHSS and availability of information there. There were some recommendations that we're working on, at least from the public side. And then with there was a follow-up effort with the acute guardianship task force in developing one-pagers. So I could take the lead on finding out kind of the results of those efforts and seeing if there's something we could just leverage from that rather than reinventing the wheel. So I wanted to toss that out there as one of the pieces, but we can discuss around existing resources. And then I think we've already said there is room for enhancing public awareness. So maybe what does that look like, and what kind of activities are we thinking related to that bullet?
And one of the things I would insert there very much, because somebody brought up an excellent point when they were talking about going through COVID and if they had a family structure or family unit. And I think that's one of the groups that we need to reach out to, is that younger family unit, so that you can be like, have that talk with mom or walk with me, and lead them through, because when often they don't realize they need help until they're really in an urgent situation. And so instead of just looking at that that age group that needs the service, we need to maybe look back for those that might be part of that family unit that have to help provide that care.
Excellent point. And Will is taking that down. And with that, I want to tease that out another extra step, because I'm interested in, what does this look like in application? Do we have ideas of where we should be that we aren't, and ideas of where we are, but maybe not robustly enough? And I'm thinking primary care physicians at the hospital. So wherever you're going to catch somebody for a medical appointment. But, I think we are out there in some places with outreach materials, and maybe just pick up on that piece to talk a little more about where we could bolster those efforts.
I could add to that. I think about the isolation, and, seniors might be getting out for doctor's appointments or what have you, which is good. But I also like to expand the resource of, in Delaware, to have more visiting physicians that actually go out to the homes. And I think that could also help identify too, resources that are needed for individuals, and also have that connection and, relationship piece too with someone in the medical field as well. But just throwing that out there.
I think
It probably would be, oh,
sorry, should I go? I think faith
Yeah, go.
communities are another place where we could share information. So.
Representative, you were going to jump in. Will's got that last part documented.
Oh, I'm sorry. I was going to say another opportunity for us to think about is we're going to have 3 residency programs in Kent and Sussex County, which, is something unprecedented for us. If we could have a connection with each of those, to start off with, that mindset of services and sort of, teach them that as they're learning, to bring that along might be, as well as some of our training and teaching institutions. I'm not sure, how much, I mean, I know there's all kinds of standards and everything else, but just so that they understand about needs and resources in the community.
And another cross-cutting issue with the acknowledgement of our workforce and the imminent retirement of our physicians. What an opportunity to continue to inform our geriatric healthcare providers.
And to sort of, Representative said something, and it kind of triggered my thought process, and then combining with what Deborah was talking about in terms of Lori's hands. Not just the residency programs, but also our college students, right? So it may not be something that directly impacts them, but maybe, their mom is taking care of grandma. And maybe that's as they're walking through, whether it's a nursing program or whether it's a, PT program. I think also, again, just that awareness that here, these things are out there in the community. I don't know that there's a wrong answer here in terms of where we can be visible, which is kind of a nice place to be.
I think anywhere that you go where the people are, or they're going to be in congregating, whether that be for many of them in churches, and we have some very large, church organizations, and they do other work as well, as they should in their community. If we look at veterans organizations and just different groups where we know there's a lot of people that congregate, if we have information there or able to provide, which we are providing a lot of programs, but I think we have to start going a little bit to meet them where they are, rather than having them just find us.
Just to piggyback off of that too, just to maybe set a regular cadence of educational or resource events, community events, Zooms, so that it's, consistently out there, and we're not just, having pop-up events here and there, just to have more of a strategy around it.
And I agree. I think the consistency of the message, right? The more people see it, the more people hear it, the more that it becomes part of that thought process of, oh, I do remember that. Oh, yeah, absolutely. I can call, this place or this person. I think that's a great idea.
Getting back to one of the things that I'm sorry, I can't, because I can't see who's necessarily saying what, but someone had mentioned about, the financial differences where some can get assistance and others will have to do that, more on their own because of their ability to self-pay. And maybe that's where there's a way to reach some of the financial planners or different financial groups and share with them some resources, because sometimes they might be having a conversation and think that there's, either a financial concern or just other concerns, and they could be, help mention if you're needing this kind of assistance or something, and they could also be a means to hook them up with services that they might be very willing to and able to pay for, but they just don't know how to access them or what might be available.
And just to add to that too, maybe you want to add like elder law attorneys to their huge resource.
And a good crosswalk with our legal services subgroup.
Yeah.
And I would just, all of these bullets that Will is documenting so beautifully are under the outreach approaches with family caregivers, but I think the same approaches could be done with the first bullet, the enhancing public awareness of and access to home and community-based services. So I think it's to more than just the family caregivers. So maybe it's, I don't know how you move the bullets around, but it would be for both the individuals and the caregivers that would need this outreach. I also thought, and we have Carol on the call, that civic associations is another way. Some civic associations are much more active than others, but getting the information out to residential groups, whether it's a civic association or a homeowners association, working with the 55 plus communities. So again, there's just, then I thought of corporate HR groups, there's a lot of entities. I think we'll have to prioritize this group and figure out the way to connect with each of them. But a lot of ways to approach it.
I think too, and I guess it loops in here as well. The social media presence. I know my parents are on Facebook, and they were or my mom was a caregiver. So I think that's important too. There's a lot of people out there that utilize social media, and we'll be surprised the outreach you could get from that too.
And sort of like down that rabbit hole of social media, there's a lot of those network groups in social media, and especially when it comes to caregiving or the support for veterans or something along. So again, that definitely goes down its own little rabbit hole, but there is a lot of information and a lot of networking that can be done on that avenue. Absolutely.
I'm going to join you there, because I think that that's such a good, really specific place where we could build on this idea of facilitating and fostering community, and so it would be helpful if we had a plant as part of that group to help make sure that resources are shared, and that also information is just coming back on what's happening as part of that conversation. So someone, I guess, guided groups that could be meaningfully leveraged.
I find it amazing the 90 and 95-year-old folks that follow me on Facebook, and they say I don't put anything on Facebook, but that's how I find things out. And so I think we definitely need to use that as a resource and a tool.
Hearing the slowdown on this bullet and what a great, what an amazing list we pulled together in 5 minutes already. Do we want to jump to the next bullet, which I think could also be a pretty robust conversation, and that is review service coverage across the state and identify any gaps in coverage?
I think, again, it's cross-cutting into another, work group, but the workforce, that's a big one. That's top of mind for me too, being in, home care. So I think that's definitely, a gap that we got to continue to work on.
Is there any way we can like highlight, bold, underline, and increase that font for that one? Because that would be, thanks, Will.
Yeah.
I think transportation, if we're going to talk about access or about isolation, transportation is extremely important. And it's definitely an issue in Sussex and in rural Sussex County.
I'll add with the big buckets there, of accessible and affordable housing.
I wonder when, because I'm rereading the review service coverage across the state and identifying any gaps in coverage. I think too, when we're talking about affordable and financial, just the understanding of what's available at different financial parts in somebody's, I guess, continuum of care, where they may fall, what that looks like. I don't know how to phrase that or if that necessarily fits here, but I definitely think that that's a gap, understanding that when I'm here at this income and this is what I have available and assets and, this is what I can do with that and what's available to me or where I may have to stretch a little bit. And then as I spend down or as I, sort of walk through caregiving, what that could potentially look like as that changes. I think that, and again, I'm not sure if that fits here or not, but I definitely think the financial piece and availability is can be linked together somewhere.
And Maggie, to tease that out a little bit, I think that also gets to this idea of, for a number of reasons, stigma being one, a lack of planning ahead of time. And could we meet people where they are to provide educational and planning opportunities, and they would need to be as varied as our aging Delawareans are in the approaches to begin thinking, from financial planning to just really getting people to start thinking about their future and getting ready for it. And so, where do we catch people and start providing that kind of opportunity to begin thinking about their long-term future?
Yeah, that's a great idea. The VA about 2 years ago, they were holding these weekly forums, and they were targeting some of that information. One week there was somebody from the Social Security Administration. One week there was somebody from the benefits, and I think somebody from your group, Matt, from Biota, had been there too. It was really great, and there was a lot of information that was presented, but it was not. There wasn't a lot of individuals out in the audience to be able to grab all of this great stuff. And again, when we're talking about that preparation and understanding where they're falling at different timelines. But again, I guess I don't have an answer. I'm just sort of throwing out other ideas and what has happened that I thought was really beneficial.
I think sometimes people are leery or afraid of they're going to try and sell me something, or, if I'm going to a presentation, because there's many groups out there that, at a certain age, try and lure you in for retirement planning, when really underlying, they're trying to sell a product or something. And so people get leery and don't attend some things because they don't want to feel pressured. They'd like some information, but they don't want something that's, you know, sponsored by this group or sponsored. It's a connotation that they're going to expect me. You know, it's just not good information. There's strings attached, or I'm going to get an approach, and I don't want to have to deal with that.
That's a good point. And I think too, the presentation was only held in Newcastle County. And so to the credit of making sure that when we're providing that information, that it's across the board, that it's all in all 3 counties, and knowing that Sussex County has such a large population, to be able to keep that standardized across all of our state.
I think there's probably good reason to acknowledge caregiver supports as a service coverage gap. And I think we've acknowledged it in other places, and we have some efforts to look at that, but I think it's worth putting on this list, and that we need to continue to look to ways to bolster the supports we offer.
I just want to throw this out there too. I know, you know, our purposes are really, you know, proactively getting the message out there so people are prepared for whenever they do need services or currently need the services too. But I don't want to lose sight of, you know, life happens, and you could in an instant be a caregiver too. And whether we could loop into hospital systems or what have you to kind of set a requirement of resources that need to be given to families or people. I know they provide resources like different providers, et cetera, but a set, you know, resource tool that's consistent and can be given to families, I think would be huge too.
I'll throw another one on the list because I'm interested in seeing how we could move it forward. And that's this concept of a dementia-friendly Delaware. And so in the biggest picture sense, gaps in coverage being just an accessible, available community for individuals suffering from dementia and their caregivers, and everything that entails, from businesses that understand and are available and accessible to the physical layout and planning structure. So I know that's a big picture one, but I think it's worth putting on the list. And to that end, memory care, I would suggest we need to continue to, you know, as that need will rise with our aging population, I think we need to continue to keep memory care in our sites as a surface arena that needs to continue to be strengthened.
And I think with that, definitely family caregiver education, just because there's a lot, you know, I know in our day programs, as we're talking through that with family members, there's not a lot of information that they get from that. And I think that's critical so that they can make those pointed decisions for something that's such a critical aspect.
And again, with the memory care, I think there's a continuum so that people can start looking at how to have healthy brains and as they age, and also then supporting people in early memory loss and later, you know, in the medium stages, and then later in dementia. So, and utilizing existing community resources. So early memory loss programs, for example, at senior centers, before people would need an adult daycare setting.
And just to piggyback off of the educational piece too, you know, and outside of different forums or events that could be held, maybe the option for some self-directed learnings, whether it's a video on, how to approach dementia individuals, care tips, just something like that where somebody could move at their own pace. I have 5-10 minutes here. Let me click on this and see how I could care for mom, better than I am currently, or how do I get better at making sure I'm meeting her needs.
And I'll put a plug in because we do, as a state, offer something called Savvy Caregiver that's available as a self-paced. So that's one example, but I think we could both make sure that that's more broadly available and known, advertised. But I think that's an example where we need maybe a variety that's going to be appealing to a lot of different audiences. All right, seeing this slow down on this one, are we ready to jump to the next bullet?
Yes.
Okay. All right. So the last bullet that we had identified, and I think we could pick more if we need to, consider barriers and strategies to improve coordination of services across public, private, and nonprofit spaces. So I'll jump in and get started in that. I would suggest a barrier would be just knowledge, meaning awareness of who's doing what in these different spaces.
And I would agree. And the other thing is to talk about building relationships. Unfortunately, so many times, some of these organizations feel that they're competing for the same dollar, because they're either, through funding levels or whatever. And so we need to make sure that we know who's doing what where, and try and when we're struggling for human capital, in other words, some of the folks to actually do these jobs, how we could work more effectively together, and many of them are doing that, but there's just, I think, we don't even know everything necessarily that's going on in the private sector. Do we need to have better coordination with some end-of-life services, and, for that transition from one phase to respite to maybe where a person is going to need to have hospice care? I mean, I just think, like you said, so sometimes things are siloed, and, to be able to point people to know what's out there for ourselves, even from the state level, is so important. Who's doing what, when, where, and how.
I'll throw out another idea for a strategy, and that's this idea that's come up already a few times, and it's a navigator. That would be really interesting to see across sector navigator, but why not? So maybe the concept of someone to help guide and coordinate services across sectors. So it would be person-centered as opposed to agency or funding-based centered.
Which is great, because that really does promote that whole idea of choice, right? We want to be able to provide the choice, whether it's for the service or for the provider. So I love it. It's a good idea. I have to give Sue a whole lot of credit. I think as we're talking about some of these challenges, and we're trying to address the current challenges, I love that, Sue, I love that you keep thinking about, well, how do we, instead of being reactive, how are we proactive to help, mitigate that up front? So well done, you. I think it's a great thing. I think it's making me rethink when I answer something to say, okay, wait a minute, hold on, where is she going with that? But well done.
I think one of the things we need to examine too is cultural differences, because sometimes we don't realize, we're well-meaning and well-intended, but we don't realize how different cultures may view things. And for instance, recently, Dr. Tam, who was our new CEO at BB, was talking about while he was with his father, who was a Chinese immigrant many years ago, and how he would not ask for pain medicine because that was insulting the physician who was supposed to be taking care of you. So he would ask his son to tell them he needed the medicine, his son who's a physician himself. And so I think as we're thinking about some of these things, as we're thinking about them, we have to think about and really have discussions with some of those cultures, because I represent an area that, you know, is 20% Latina and English language learners at that. And the culture there to take care of family is very different. So we don't want to be insulting by suggesting they can't take care of family. I don't know if you're understanding what I'm trying to say here, but I think we need to be culturally sensitive and have people that can help us with that dialogue and understand, whether that be the Asian culture, whether that be the Latino culture.
I agree, Representative. My husband is actually Costa Rican, and so in their culture, it's the responsibility of the children to take care of their parents. That's kind of how they look at it. That's what they do, and they don't really go outside to physicians and look for some of those extra supports. So I do agree that that is something that we as providers should be looking at as well.
Just to another strategy just to throw out there too, not lose sight of what other states might be doing, and we could pick up on a lot of great ideas and have an understanding of the impact that whatever practices they put in place, you know, what they did for the community.
Forgive me, I'm going to interject. I will be sending out some materials that have been featured in the full working group that cover some of those best practices just for future reference. Senator Matsiminos actually recommended that I do that, so those are forthcoming.
Excellent, thank you. All right, we've slowed down on that one too. And those were, let's see here, 3 bullets, I think, to get us started. Are there other, when you signed up for this or were thinking about coming to the meeting today, what have we not talked about that you were expecting to be part of this conversation? Interestingly, funding hasn't come up much at all. So I wanted to point that out when we're talking about access.
I thought that was a trick question.
Yeah.
I didn't want to
Yeah.
ask on that one.
Well, then maybe, oh, go ahead, Representative, you're going to say something.
No, I'm fine.
I was going to say that I do think funding is an issue.
Agree. Well, then maybe we're at a point, and with just about half an hour left, I think it's probably a good timing to start thinking about our strategy then. You know, we have a really robust, I think, array of things to think about and ideas to leverage and problems to solve. And so thoughts on how we want to organize this information and get started. What do we want to do with this? Are there information gathering things we want to do, or take it to stakeholders? Those are some initial ideas just to get us thinking of how we're going to tackle this.
I think the notion that we first of all need to know who's doing what, and then ask them, like a survey to ask, you know, what they're doing and what barriers or obstacles they have to provide the services. Maybe that I'm sure you're going to find about funding and access for direct care personnel. But I think that, to me, that's the first piece of the puzzle. And I can't imagine that one of the other subgroups isn't wanting the same information, who's doing what, you know, to provide what services we're offering and who's providing them where and what that picture looks like. And then if we could have what type of communications we're already doing. I mean, we've talked a lot about that, but we haven't actually, you know, had a look at that either, about obtaining access. What does that look like? Services. What kind of weight do we have? If I call today and I need services, talk about assessment, about time to access those services. That would be, I think, I would be interested in knowing.
I think a follow-up to that might be, it was mentioned earlier about sort of the areas in Delaware that we have these more concentrated populations, because it's great to know who's doing them, who's doing the services, but where are those in relation to where the population is, right? When we're talking about access, are we looking at a lot of these individuals maybe based out of Newcastle and the population is greater in Sussex, right? So then there's sort of like, great, we have that service and we know that it's there, but how close is it to the population that needs it? I think that might be a secondary piece to that.
I know that the Institute of Public Administration at the university started doing this work earlier this year. They had a grant with Newcastle County to start mapping some of the services. I don't know how far they got with it, but they were actually creating an interactive tool that people and organizations could use to see what was available in their area. And I think, I know all of us are busy. It may be that engaging with some students who could make this as a research project and going to IPA. I mean, I can follow up with Julia O'Hanlon there and to see how far they got. And that might be a place to start, at least a springboard.
I was just going to add as a next step, and I know it'll probably naturally happen, but share what we suggested with the greater, the bigger group, and there could be some overlap too. So where we could partner with the other subgroups, so we don't have multiple people working on the same thing.
So I think this is.
Yeah,
Go ahead. Go ahead, Representative.
No, I was just going to say I agree with his comments, because I think that in order to determine a strategy, that we need to understand what we have, and then we need to prioritize some of those things we've said, as to put some of the highest priorities first, the ones that will make the most significant impact. And then work, because if we do think that we're facing limited resources, then how do we get the biggest impact for that initial investment? What will filter down in other ways?
So I'm thinking about asking our Delawareans some questions about their perspective on so many of these different issues. And I know I'm thinking of that because we're doing caregiver feedback focus groups really soon, but is for consideration a survey or some sort of tool to gather information, and will need to be targeted because there's so much here. But one area, again, to what Sue was pointing out, of hitting hitting the concept of aging a lot sooner, both to hope to try to turn away from the stigma, but also just to get people thinking. And so that area alone, I would really be very interested in surveying younger people to find out where they are on thinking about it, what the attitudes are, and then what might be appealing to them to begin to think about planning and aging, and everything from their attitudes towards nutrition and physical activity as a component of healthy aging, to financial planning, to more in-depth topics like, what are your thoughts about long-term care services and supports? Where do you envision yourself? Do you have caregivers in mind, as you age? And those kind of questions and thoughts, to just kind of understand where people are in their thought processes at different ages.
I love that, just to gather some real data and information out there from the community. I just with surveys too, I would like to make it as painless as possible for people too, right? So, if it's a phone survey, I don't know if everybody's gonna, respond accordingly, but if we have the technology to push out like a texting or something where it's easy, 5 questions, and we could still gather what I guess the heart of what we're trying to accomplish. But yeah, I mean, I know it's better to always talk to someone too, but just throwing that suggestion out there.
Or for instance, many of our legislators, I think of my colleagues and myself, we send out surveys through Facebook, and it could be easy to, enlist some of those folks that already have those communication channels open, to say, would you mind taking this and pushing it out to your constituents and seeing what kind of response you get. I represent significant number of in-migration retirees in my district. One community can have 500 to 600 new households, and just about all of them came from New Jersey or New York. And so getting feedback that way, or doing another way where you're reaching out to another group, some different ways to reach those groups and get back. Use the same survey instrument, of course, but there's other ways for other groups to help push the same thing out. You just want to make sure you're not getting the same people responding to multiple surveys.
And Representative, I wanted to circle back on something you were saying just prior about the prioritization of our to-do list, and wanted to suggest as part of that, we consider a ranking system of where we are, so that we can acknowledge, this is a priority because there's nothing here at all, or
Right.
This is a priority to improve because it's really got good, either good success or it's where the direction we want to head, but maybe just also as part of the inventory process, I guess, the prioritization acknowledge where we are in the state. We have some of it, none of it, or we need to strengthen it.
Right. Exactly.
All right, well, this is a good to-do list, and I like the idea of outsourcing our work, especially where we where it's something sophisticated like mapping services. Is so Monday the 22nd is only 10 days away, so I don't think we'll get a lot of this done before then, other than just our feedback opportunities and the crosswalking pieces, which I think are the most important for Monday. Do we want to take a stab at how we'll get through the to-do list here at the bottom?
Yes.
And I pose that as a very loaded, wide open question.
Well, maybe that's where we begin. The prioritization is on the list. So I'm not seeing the list, obviously, but I remember what we just did. And I think we know that it's going to take a while for somebody to compile who's doing what. I mean, just finding that out is going to be, but it would be interesting to see if any of the other, and I'm sure William can say, some of the other groups have already identified the similar thing that needs to be done.
What do you think of a simple ranking just from our group right here to start with? So we maybe we can ask Will or take it on ourselves to just put everything kind of in a list with a Likert scale, of just to begin prioritizing the issues. And then we could maybe go from there about diving in and how to target some of the next steps.
I like that idea. I was thinking something similar, that we do it ourselves before we take it out.
Yeah. So if we do that and then send back to Will how we would rank them. Is that what we're saying?
I think so. I think we would need to, Will, I think I might need to ask to get your feedback on this. First of all, are there other subgroups that are doing similar things? We can just pick up on their ideas of prioritization. And if not, I think maybe I could volunteer to work with him to just set up the scale 1 to 5 equals whatever, and then we'll put the list together, if that would work for you all.
Yeah, of course. So this is actually only the second subgroup to meet. So the previous one was social determinants, which is going to be doing a similar type of internal survey, but specifically like weighting different social determinants of aging well in terms of their, I guess, severity and importance to successful aging. So it's a similar idea, but it's, I think, a little bit different, like content-wise. But I'm happy to assist in creating a survey.
Terrific, thank you. I'll volunteer to kind of help set up the structure, and then we'll go from there.
And it might be helpful too, William, that once we do that, you might find out as some of these other subgroups meet that you know, that the same as we just asked, if there had been a discussion or overlap, if that would be something, because we don't want separate subgroups doing the same work, you know, being redundant. So.
Absolutely. I can say that there has been some overlap from this subgroup and the previous subgroup, but everybody's taking it from a slightly different angle so far. So, but
Well,
there will be
come
opportunity.
back.
Oh, I'm sorry. Go ahead.
No, I was going to say, when we sort of expect a certain degree of that, and that helps us when we come back as a group prioritize, because if 2 or 3 subgroups have said this is a priority, then that sort of helps the final group report come up with that this is really, you know, a priority. So you expect some of that, which I just don't want to be us all being doing surveys that are trying to get us to the same answers. That's
absolutely. And hopefully I think everybody's approaching similarly, maybe with slight variations, but yeah, well, I think the next full meeting will provide an opportunity just to make sure that we're not, you know, working on the, you know, both inventing the wheel in separate rooms.
Yeah.
So it sounds like the plan then that Will and Melissa will work up the survey instrument for us to go out just among ourselves to help us prioritize our discussion from today. And we'll do that, and that'll be part of the report that we'll give when the whole group meets on the 22nd. Was there anything else we need to accomplish interim?
This is Sue. I will contact the UD Institute of Public Administration just to see where they got with that mapping process, because I was involved early on and contributed and gave feedback, but I don't know what the end result was. So I'll follow up and share that information.
Thank you very much.
Yeah, great.
I just took a look at the agenda to make sure we were being true to our to-do list, and there's an opportunity for a public comment. Will, do we have attendees that aren't part of our panel that we could open up discussion?
No, unfortunately, all attendees are either staff or panelists on the subgroup.
Okay.
Do we need to set up another time and date for meeting before the 22nd? Or are we good to wait and, you know, do we want a short meeting after we do the survey? I'm just trying to get our.
I think that's a good good next step, in that I don't think we have another work group planned. So Representative, I want to make sure, I think there's 2 different questions. One is the schedule for meeting, but also if we have a deliverable we intend on having done by the 22nd.
Correct.
Okay.
That's correct.
Okay. If we get the simple survey, which would just be the list of everything we talked about with a scale, out to you early in the week, could we have it by next Friday? Yep. Okay.
Yeah.
So that can be a deadline that we can work with, is to have the survey instrument out Monday or Tuesday, with responses back by Friday, so we can have that information for Monday's 22nd call. And Will, this is leaning on you a little bit, and I know you're managing 4 subgroups in a work group, so that might be a little ambitious.
I think, how about if you get the survey instrument to us by Tuesday, that we make it a priority and have it back by Thursday, rather than, because that gives them a little more time. I can't imagine what.
Okay, maybe we can use an Excel sheet to auto tally for us or something, keep it simple for us.
Yeah, exactly.
Okay, and then in terms of regularity of meeting, what is the group's preference in terms of both frequency, and then if Friday morning was a doable time this time, will it continue to be a good time for this group to meet, or do we want to just try to target it through the doodle poll process?
For me, it would work best
Doodle
through
poll.
the doodle poll because, yeah,
Okay,
I don't know what Will says because he's the one that has to manage that. I just, my schedule is just all over the place. So it works great if you know you can say we're meeting at a time certain, you know, on Monday mornings, but even that doesn't work well for me. So.
and I'm seeing affirmative nods from other members of the group saying that that's the same case for them. So we'll go about it with the doodle poll process.
Awesome.
And just as I guess a note, due to Freedom of Information Act requirements, there's some reporting. So these polls will have to be put out fairly early and well in advance of meetings, just so we can plan it out. Just out of curiosity, was the survey tool used? Was that okay with everybody? Were there any issues? I know that it was a little bit hit or miss, but
I had an issue.
yeah, okay. Then I'll try a different service this time to see if that can work better. But thank you.
Yeah, the survey asked me to add an extension to my browser. You can't modify your computer, corporate computers.
Totally understand.
Exactly.
Mhm.
So with the requirements, Will, that we need to make sure that we adhere to, what's a reasonable kind of next meeting timeframe? Are we out 3 weeks to 4 weeks with that kind of timeframe, acknowledging that we're meeting at the 22nd as a group as well?
I would say that probably 3 weeks from like creation of the survey would do it. So FOIA requires that meetings are fully noticed with meeting links and all within at least 7 days prior, 7 calendar days, and then there's about maybe a 2-day turnaround with IT. So there's, I think all told, probably 3 weeks is just about where it could be. In theory, we could maybe do it in like 2.5, but that may be pressing it.
Okay, so that looks like right around the beginning of December is when we'd come back together again, if we moved as quickly as we could. Does that time frame work for the group in terms of the next time we get together?
Yeah. Mhm.
Yeah.
I mean, it
Great.
does.
Okay. Okay, so we'll get it together and target the beginning of December to come back together.
Sounds good.
Okay.
All right. So that is then the end of our meeting today. And we'll be communicating via email with Will on the survey and then on our polling for when we can meet. But we've sort of decided around the first week of December would be our next meeting. So
Looking forward to seeing you all then.
yeah.
Thank you,
With
everyone.
that, we'll adjourn and go our separate ways and convene again. Well, I know some of us will on the 22nd and then again around the first week of December.
Okay.
Sounds good. Have a good weekend, everybody.